Welcome back to It's Personal. It's Personal is brought to you by Gunderson Health System. I'm Christopher. As we mentioned, Megan Meller is here, infection preventionist at Gunderson Health System. We talk about the flu a lot. It is flu season. It seems like the flu is really a year-round thing anymore. What can you tell us? What's the latest on the flu, maybe from a national perspective and even from a local perspective?
So I think the best is to start from the national perspective. So we know it's flu season. The southern part of the country is experiencing high levels of flu transmission. This is according to a report that comes out from the CDC on a weekly basis. We know that there are some hospitalizations associated with this, but that's not unheard of. So far, it does appear to be a mild flu season. Interestingly enough, we're seeing more cases of influenza B circulating right now versus influenza A. Now, the good thing is that influenza B is part of the standard, what we call quadrivalent influenza vaccine. So if you've been vaccinated against the flu, you have a pretty decent shot of not getting sick from influenza B, which is, again, pretty fantastic. But what's rare about this is usually we don't start to really see many influenza B cases until the latter half of the year. So if we zone in then on the Midwest is not seeing really any active transmission of flu. We're seeing sporadic cases, so low level, which, for this time of the year, I'll take it. I would take low level transmission over high level transmission any day. But this is, where we're seeing on a local level, we're seeing influenza B cases more than we are seeing influenza A.
And that's kind of a surprise to the infection control community, I would guess.
It is, and I think public health community too, just because we don't typically see B until end of February into March. That's when it tends to, we tend to see an uptick in that when A is coming back down.
Any special concern because of that?
No, people with an influenza B illness with the flu doesn't produce that severe of an illness compared to A. So, you might not feel the greatest, but the disease course tends to be a little bit more milder.
Okay.
And then for influenza A, I think right now the predominant strain is H3N2, which is the strain that we've seen the past couple of years.
And it's not going anywhere, it seems.
It doesn't appear to be going anywhere.
All right. Now, there has been some places with outbreaks around the country. Has the CDC or has anyone identified any specific hotspots? Because there's a lot of folks that travel this time of the year for the holidays. Hotspots, I could say, or states that I know of, again, that are experiencing active transmission would be like Louisiana, Alabama, Georgia, Texas. So states states within that part of the southern U.S. Yeah, kind of an unusual place for the flu to break out, wouldn't you think?
Not really. So
No?
I think in past years, that's where we tend to see cases of the flu happen first, is like the East Coast, southern states, and then it starts to kind of spread throughout the country.
Is that a flu shot thing? Is that just a...
I don't think there's a rhyme or reason as to why. I think it
hasn't been identified yet?
I don't think they really try to identify that, from year to year. I think it's more just, it's luck. It's what happens, and do you have the right conditions for it to spread?
All right. And
so it's hard to tell.
I do want to give you the opportunity to talk about how to avoid the flu because, as I said, a lot of people traveling, a lot of people not only on airplanes but in with family members. Here's your opportunity. What do you want to tell them?
So I'd say, if we're going to talk about the flu, then we'll tack on, common colds, because it's also that time of the year too where colds are coming around. And the preventive measures that apply to the flu also apply, for the most part, for the cold, with the exception of being, for the flu, there is a vaccine for it. We don't have a vaccine for the common cold, unfortunately. But one of the biggest things is hand hygiene, making sure your hands are clean. After you're done eating, even if you've touched like doorknobs or other surfaces, just being mindful of that. And then along with that, being mindful of not touching your face. So we call it, in healthcare, the T-zone, the eyes, the nose, the mouth, because they're mucous membranes. That's how colds and flus, that's how they latch on. That's their entry into your body. And so if you can avoid touching those areas with dirty hands, then you're going to go up that's going to be a really good way to prevent you from getting sick.
A lot of prevention.
That's a lot of prevention. And it's so hard. Even as an infection preventionist, it's really hard for me not to mindlessly touch my face. Yeah. But it's something that can go a long way. Along with that, it's making, just keeping your immune system strong. It's a stressful time of the year. And I think, with everything going on and, the hustle and bustle of trying to find the perfect gift and then trying to work as well, can really wear some people out, or like
And
the endless
travel and not eating maybe as well as you should.
You're not eating as well, or just like,
Yeah.
the endless
Lot of factors.
entertaining and stuff, that we always recommend take time for yourself. You might not be able to exercise for the full hour that you want to each day, but if you can fit in a 20-minute exercise, like that's going to take you far. So it's taking care of your body through exercise. It's being mindful of what you're eating. Yeah, definitely go indulge, if the opportunity presents itself, but then maybe the next day scale back a little bit, and have a healthy meal to complement, indulging, the night before. It's getting enough sleep too, which is kind of that, sometimes that elusive friend that we all wish was like, why aren't you here? But trying to get, enough sleep. So if you can do all of that, I think, that's definitely what I'm going to try to do, to avoid getting sick. Because, I don't want to get sick. I don't think anyone wants to get sick. But by taking those steps, you'll have a pretty good fighting chance at not getting sick.
Sounds like great advice to me. And by the way, happy holidays.
Thanks. Happy holidays to you, too.
All right. Megan Meller, infection preventionist at Gunderson Health System in the Infection Control Department. We appreciate her and appreciate you. Thanks for listening and thanks for watching. This is It's Personal. It's Personal is brought to you by Gunderson Health System. I'm Chris Doffer. Thanks for joining us.